Assalamu alaikum and good morning. In this blog today, we are going to talk about the disease of the thyroid gland. Now, thyroid gland is a small gland in front of the neck. What we call commonly in Pakistan is when it gets enlarged or disease, we say कि गिल्लड़ हो गया है या गिल्लड़ की बीमारी है. So the thyroid enlargement is called as goiter. There can be many causes, but today we'll talk about the iodine deficiency. Now, let's understand the fact that for the formation of thyroid hormones in the body, iodine is important. So, when there is iodine deficiency or less iodine in the body, the thyroid hormones will not form or function properly. Thyroid hormone is called as a hormone of life. It has a calorigenic action. So, whatever we eat, whatever energy we get, thyroid hormone has a part to play by its action. Now, when we get the enlargement of thyroid gland, suppose it occurs in younger female around teens, 15, 16, 17, it is called as puberty goiter. If it happens in pregnancies, it is called as pregnancy goiter. Once the goiter is diffuse, there are no knots in it or nodules or knobs in it, it's a diffuse enlargement, especially in the puberty and the pregnancy goiter in the early stages. We can give thyroid hormones to take by mouth, and this diffuse enlargement sometimes goes away because the stress in the body, which is asking for more development or more growth, thyroid gland is enlarged. If we give that hormone from outside, sometimes it goes away. But if it is late, or the presentation or the patient goes to the doctor in a later stage, then there are knobs or knots, then it's difficult to treat by hormones. So if we have an iodine deficiency goiter or any enlargement of the thyroid gland, we must go to a doctor and consult a doctor. Simplest investigations to be done are in the blood. We do TSH, T3 and T4. These are called as thyroid hormones. Then we put in a needle, very small needle in the thyroid, and we take out cells and we see whether it is a autoimmune disease, whether it is iodine deficiency, whether it is some kind of malignancy or cancer. And then we can actually plan the treatment. The message is, if you do not go to a doctor or if we do not consult a doctor at an early stage, the simplest of goiter or enlargement of thyroid gland can become complex. If the size of the thyroid gland is quite large, it can compress the food pipe which lies at the back of the thyroid gland or the windpipe through which we breathe. So there can be problems in the breathing or there can be problems in the food intake. We can have dyspnea, we can have tachypnea, we can have dysphagia. So whenever there is a disease of the thyroid gland, whether it is a very small nodule in front of the neck or on the side, a small swelling, anything, or we feel that something is causing pain in the neck, it is very important to consult a doctor. Thank you very much.